Chapter 5 is the respiratory system. Pulmonary system, respiratory system. The structures and what they basically do. Starts at the nose and the mouth. The mouth isn't so much part of the respiratory system, but we can breathe through our mouth. Some animals can't. The nose, nasal passages, the pharynx, which is in the back of the throat, not pronounced pharynx. It's pharynx. It rhymes with lynx. Larynx, also, that's your voice box. It carries vocal cords. Trachea, the single tube that goes down toward the lungs. Bronchi, starting off with just two, one to each lung, and then they split off and split off and split off into smaller and smaller bronchi. They reach the alveoli, which are the little air sacs that actually exchange the oxygen and carbon dioxide. The lungs then are made up of the air passages and the alveoli. The vast majority of your lung tissue is alveolar tissue because you have a massive cross-sectional area to exchange gases. Exchange of oxygen from the atmosphere into your blood happens at the alveoli, and the exchange of carbon dioxide from the blood at the alveoli to the outside happens in the same alveoli. So you have oxygen going into the blood, CO2 coming out. Movement of the air in and out of your lungs is called ventilation, not exactly respiration. Respiration includes all of the following procedures that take place when oxygen gets to the tissues and gets used there. So ventilation is really what we're doing when we're breathing in and out. Air comes in the nose, nasal passages, pharynx, larynx, joined by the oral cavity, the mouth passage. You have an epiglottis here that is a flap that will close off the trachea when you're swallowing food, so food doesn't go in your lungs, and then it goes the other way when you're breathing so that air doesn't go into your stomach. The lungs, the pleural space around the lungs is a little vacuum sealed place that helps suck the lungs against your chest wall and hold them open. The mediastinum is between them, is where the heart sits. Here's the alveoli at the very end. They're very tiny sacs, and they're in little clusters of grapes on the end of that last smallest bronchiole. Your bronchi are the bigger, stiffer tubes. The bronchioles are right down at the end there. They're muscular, and they can open and close to let air go in or not go into a certain area of the lungs. Upper respiratory tract is the nose, throat, and voice box. So if you lose your voice, that's an upper respiratory thing. Anything below that, the single tube trachea and everything below that, is a lower respiratory problem. The diaphragm is your main breathing muscle. We have intercostal muscles that also cause the chest to go in and out, but the diaphragm is a big sheet of muscle here that pulls downward when you breathe in. It stretches the lungs and makes them bigger so air goes in. Here's your epiglottis, larynx. Sinuses are actually holes in your skull that communicate with your nasal passages. They allow pressure changes to occur. They make your skull lighter, and they give more resonance to your voice as well. Tonsils are lymphoid tissue. They're part of your lymphatic system, your immune system. In the back of your throat on either side, The tonsils, they like to get infected. They sometimes get taken out. Mine were when I was a kid. And adenoids are growths off of here. They're also lymphoid tissue. They sometimes will overgrow and wind up causing sleep apnea. Your airway collapses at night and you have a hard time breathing. Sometimes adenoids are taken out as well. The nose and upper airways warm the air, filter the air, and moisten the air as it comes in. The lower respiratory airway is primarily transportation of air, but the walls of the airways are covered with ciliated cells, and these little tiny hair-like structures move mucus out of the airways and take debris and viruses and bacteria. Anything that you breathe in that sticks to that mucus gets brought back out so you don't get a lung infection. Larynx is the voice box. On a guy, you can see it move up and down more. It raises and lowers to stretch and relax the vocal cords, so change the pitch of your voice. Epiglottis, I mentioned, the trachea, the initial single tube. The bronchi is plural, bronchus is singular. Large bronchi, smaller, smaller, smaller. Bronchioles are the muscular ones that control airflow, and the alveoli are the air sacs. Lungs are very spongy. They're always trying to collapse. It's your pleural space, that vacuum that pulls them out and pulls them against your chest wall, that keeps them inflated. If something happens and you break that seal, the lung can collapse. Diaphragm, I mentioned, the muscle of breathing, main muscle of breathing, and the mediastinum, the space that the heart sits in between the lungs. So now let's look at what we actually call these things. Well, adenoid O is for adenoids. Alveolo is for alveoli. Bronchio or broncho is for the bronchi. Diaphragmato is for the diaphragm. There's a couple places where it's called phreno. The phrenic nerve controls the diaphragm. So phreno can be another term for the diaphragm muscle. Epiglotto for epiglottis, laryngeo for larynx. Lobo for one of, it's not somebody who goes to University of New Mexico, but it's one of your lobes of your lungs. You have 2 lobes on the left and 3 on the right. So you can have a lobal pneumonia just in one lobe. Or you can have a lobectomy where they take out one lobe because it's cancerous. Naso and rhino refer to the nose. Naso, your nasal passages, we know that. Rhino, though, is used for a number of diseases. A rhinoceros is a nose monster. Rhino means nose. Pharyngeo for pharynx. Pleuro is the lining around the lungs. The lungs themselves are pneumo, pneumato, pneumono. So pneumonia is an infection of the lungs. Pulmono can also be used to refer to the lungs. They're important enough. We have several ways of saying them, unfortunately. Septo is the nasal septum between your 2 nostrils. Sinuso is your sinuses. Thoraco is your thorax, where the lungs sit, your chest. Tonsillo is your tonsils. And tracheo is the trachea. So the good thing is most of these things are named after the part. They make sense. Pneumo and pulmono, they'll refer to the lungs. So you can have pneumonia or you can have a pulmonary embolism. Some things referring to the lungs. Atello means incomplete. Atello, incomplete, incomplete of inflation. Capno, carbon dioxide. A capnometer measures your carbon dioxide in your blood. Hypercapnia, you have too much carbon dioxide in your blood. Hemo and hemato refer to blood. So if we have blood in the lungs, we can use that. Muco is mucus. Ortho actually means straight or kind of upright. An orthopedic surgeon was supposedly somebody who made people straight again after they got broken, I guess. Oxy or oxo is oxygen. Phono, speech. A phonograph was a thing that sounds people speaking would come out of. So phono is speech. Telephone. Telegraph gave you, over the lines, you got written word. A telephone, you were able to speak over it. Pio, pus. Radio is radiation, like radiation therapy or an X-ray, like radiology. We're going to radiology. Somno is sleep. Sono, we're going to use this a lot. Sonograph is ultrasound. That's an ultrasound machine. So sonography is using an ultrasound to look inside you. Spiro is breathing. A spirometer tests how well you can breathe. And tomo, remember cutting that tomato? A tome is the machine. Tomo means to cut. We've used a couple of these. A or an means without. Anemia means no blood. Okay? A or an. Endo is inside. The endocardium is the most inside part of your heart muscle. Eu means good. So, eustress. Exercise is good stress. It's the kind that makes you healthy compared to distress, for instance. Poly means a whole lot of. Tachy is rapid, like tachycardia. Your heart's beating too fast. Some suffixes. Algia means pain. Most people have heard the term neuralgia. It's nerve pain. Algia is pain. Pertaining to, AR, ARY, EAL. So you can have pulmonary, esophageal. A seal is a hernia. We're going to see lots and lots of hernias. Everything can bulge out and herniate. So we're going to have seals of the bladder and seals of the rectum and seals of this and that. But you can also have one of a lung, a hernia. Synthesis is to puncture and withdraw fluid. Most of you know of an amniocentesis, taking out fluid to see if your baby's okay. Emia is a condition of the blood specifically. So anemia, not enough blood. A gram is a measuring instrument. So electrocardiogram is the machine. It produces an electrocardiograph, which is the actually graphic representation, the piece of paper. And the process is graphy. So electrocardiography is the field, the process of using an electrocardiogram to make an electrocardiograph. And we have them for breathing too, but most people at least have heard of electrocardiograms. A meter is a recording device. Since spiro is breathing, a spirometer or spirometer is a device to record your breathing patterns. Spirometry is the method of doing it. Pexy is a surgical fixation. if your kidney is hanging out of position, you pexy it back into place. It has an X, and so does fix. And that doesn't mean repair. It means to fix its location back where it's supposed to be. Affix. Pnea is breathing. Ridiculously difficult word to say. Apnea, you're not breathing. Dyspnea, it's difficult to breathe. And ectomies we've seen, surgically remove. Appendectomy, tonsillectomy, lobectomy. We know that rhea means flow of anything, diarrhea. Rhasia is a flow of blood, flow of blood. A scope is the instrument to visually look at something. Scopic is something that was seen by a scope, so this is a microscopic image, you know. Scopy, the process. A spasm is a sudden uncontrolled contraction. You can have that of a muscle and it can spasm, or you can have that of your bronchi so that they squeeze and you can't breathe very well. Stenosis is a narrowing of any tube. So we're going to have that in coronary arteries. We're going to have stenosis. We're going to have it in intestines. And we're going to have it in airways. Stenosis. Stomy, creation of an artificial opening, like a colostomy bag. Colostomy. It's an artificial opening when a person has colon cancer and they can no longer poop out of their anus anymore. It has to come out through a new opening in the wall of their thorax, of their abdomen. The thorax is your chest. Tomy, cut or incision. Tome, tomy, tomo. Again, here we go. The gram is the they put this one backwards. The electrocardiogram is the machine. Electrocardiograph is what the graph paper. Think of graph paper. I'll have to see about swapping that one. And electrocardiography. And so we're going to be using this for pulmonary testing as well. Here we have tome. The tome is the instrument. Tomy is the cut. Tomo is a section that you actually get to look at. And tomography is the graph of the slices. And a CT scan is computed tomography. What it does is take a bunch of x-rays that slice you into pieces and produce a graph of these slices so you can look at them. Chest or chest cavity. What's that? The thorax. What means lung? Pleuro. Pulmono too, right? Which means to resuspend. Pexy. Fix. Affix. Reattach. So here's some disorders. But now we're starting to get a little bit better at this because, you know, if we know what an adenoid is and we know what inflammation is, then adenoiditis is an inflammation of the adenoids. So some of those things where we had a million words that didn't seem to connect very well, they get better and better as we go along. Alveolitis, the alveoli are inflamed. Now this one's a little bit different. Ectasis is inflation or stretch. Remember, atel meant not enough. Atelectasis is when you can't inflate part of your lung. Insufficient or incomplete inflation of this part of your lung. I think this is about the only place I've heard it used is in the pulmonary system when you have a collapsed lung or something and you can't inflate it. Atelectasis. On the other hand, if the bronchi are inflated, this is not lack of, this means that the bronchi are stretched out, like a balloon that's been blown up too many times. Bronchitis, inflammation of the bronchi. Bronchiogenic carcinoma. This is is generating in the bronchi, and it's a cancerous tumor. Bronchopneumonia. This is an inflammation or infection of the bronchi and the lungs. Diaphragmatocele. What's a seal? A hernia. Ooh. Big, fat, blown up seal, right? Diaphragmatocele means that your diaphragm, which is supposed to be nice and smooth and strong, has a weak place in it that's herniating out of position. Epiglottitis, inflammation of the epiglottis, that thing that covers up your lung passages when you swallow so food doesn't go in your lungs. Hemothorax means blood in the chest, not in the lung itself, but it is in that space between the lung and the chest wall, and it's causing the lung to collapse because you're losing your vacuum seal. Laryngitis, inflammation of the larynx, the vocal cords, and you sound like this. Laryngotracheobronchitis gets its own acronym, LTB. Well, that's inflammation of the larynx, the trachea, and the bronchi. So all of your big passages. Lobar pneumonia is pneumonia in one lobe. Nasopharyngitis, this is inflammation of your nose and pharynx. So this is a true upper respiratory thing, with the runny nose and the sore throat. Pharyngitis, just a sore throat. Pleuritis is an inflammation of that lining around your lung that can hurt and make you even think you might be having a heart attack or something. Atelectasis, not enough inflation. You have a collapsed lung here. You're unable to inflate this lobe of the lung. Bronchiectasis, on the other hand, is inflation of the bronchi. See, they're kind of herniated and bulged outward. So some built from word part stuff. Pneumatocele, pneumo is lung. Cele is hernia, a herniation of the lung. Pneumoconiosis. What is this? It's a bad condition in the lung caused by what? A cone of dust. Pneumoconiosis. This is a really common thing when people are in conditions where there's a lot of dust, a lot of mineral in the dust, or something, and it causes inflammation in the lungs from breathing so much of it. Pneumonia is an infection of the lungs. Pneumonitis, inflammation of the lungs. You know, it could be from an allergen that it's not infected, it's just inflamed. A pneumothorax is your typical collapsed lung. Pneumo in this case means air, and then the air is filling up the space between the lung and the chest wall and allowing the lung to collapse away from the chest wall. Hemothorax, it fills with blood. Hydrothorax, it fills with water. Pneumothorax, it fills with air. A neoplasm is a new growth of some kind. It doesn't mean that it's cancerous. It doesn't mean that it's not. It's something new growing in there that shouldn't be there. So a pulmonary neoplasm, you're seeing a new growth in the lung. That's really not good. They're usually cancerous. Pyothorax, pus in the lung, causing a collapse. Rhinitis, This is inflamed nose. Rhinomycosis, fungal infection in the nose, fungus among us. Rhinorrhagia, a bloody nose, flow of blood from the nose. Sinusitis, inflammation of the sinuses. Thoracalgia, what's algia? Pain, pain in the chest. Tonsillitis, inflammation. Tracheitis, inflammation of the trachea. Tracheostenosis, what is stenosis? A narrowing of the tube. Not enough room for the air to get through properly. Collapsed air with along with air in here. Air is in the chest, not in the lung where it's supposed to be. So air, pneumothorax. Pneumothorax. With blood, hemothorax. Conditions not built from word parts. Acute respiratory distress syndrome, ARDS. That means you can't breathe. It can be from a bad asthma attack. It can be from breathing in toxic gas and all of your airways have shut down. It can be from breathing in water. But if there's some reason that you can't breathe right now, it's acute respiratory distress syndrome. Asthma, a swelling shut of the bronchioles so you can't move air through them properly. COPD, chronic obstructive pulmonary disease. Quite common in the U.S. Among people my age who smoked for 30 or 40 years. You know, I've seen guys in their 50s and 60s who are just about on their last legs from COPD. There's no cure for it. You can kind of treat it and keep breathing for a while, but you see a lot of people dragging around oxygen bottles, and almost all COPD in the U.S. is from smoking. Coccidioidomycosis. Boy, that's a hard one to say. Coccidioidomycosis. Anyway, it's an infection by a fungus in the lungs. Cor pulmonale. This is a enlarging of the right side of your heart due to lung disease. The right side of the heart's trying to push blood through your lung. The lung has got lung disease. There's hypertension or something. The pressure is built up so high that the heart overworks itself and you get right side heart failure. Cor pulmonale. Croup is an infection especially common to kids that gives you a barking cough. You kind of sound like a seal. Not like a hernia, you sound like a real seal. Cystic fibrosis, a genetic disorder that causes lung problems, that causes mucus in the lungs to get so thick that you can't move it out, and you beat on the person's back or whatever trying to get the mucus to come out of their lungs. It has a lot of other systemic problems too, but the lungs is what it's really known for. Deviated septum, it can either be crooked or too wide and make it hard to breathe. When I was a kid, I kept having sore throats and finally had my tonsils out and still had sore throats. And they finally did a septoplasty. They narrowed the septum so that my nose would drain out instead of always draining in the back of my throat. Emphysema is one type of COPD. Emphysema and chronic bronchitis make up COPD. And emphysema is the one where the lung tissue deteriorates to the point where you have a lot of big air spaces in there that aren't exchanging any gas. Your lungs become huge, but they don't work very well because so much of the tissue is kind of dissolved away. Epistaxis, for some reason, they came up with another word for a nosebleed. What's wrong with rhinorrhea? That would work. Epistaxis, though, is the other term for a nosebleed. The term idiopathic means you don't really know the cause. The person just got it. Their lungs produce too much fibrous tissue, and they have pulmonary fibrosis. It makes it hard to inflate your lungs because they get really stiff. Influenza is the flu. Obstructive sleep apnea, OSA, a pretty common condition, especially with older, slightly heavier people who have sort of extra tissue in the back of their throat, and when they sleep, it collapses and blocks their airway. And they'll go for sometimes 30 seconds or even more without breathing, and then suddenly gasp and start breathing again. It's harmful to you. You go without oxygen for a while. It disturbs the heck out of your spouse, who thinks you stopped breathing totally. Pertussis is whooping cough. Most people don't get whooping cough anymore because it's one of the childhood vaccines that we get. Effusion is filling up, it's leaking fluid. So pleural effusion, like if you have inflammation of the pleura, the area around the lungs, it could be called pleurisy. And if it is bad enough that it causes fluid to leak out, it can cause a hydrothorax by filling that space up with water and letting the lung collapse. Pulmonary edema is when pressure abnormalities in the lungs cause too much fluid to leak out of the capillaries and fill up your alveoli with water. And so you can't breathe. Kills a lot of people with heart failure. An embolism is a blob of something, it could be a blood clot or something, that came from somewhere else and lodges and blocks off blood flow. Pulmonary embolisms happen to a lot of people when they sit on airplanes for a long period of time. Blood sits still too long. Still blood tends to clot. They form deep vein thrombosis, and the thrombus becomes an embolism, lodges in the lung, and can be lethal. It blocks the blood flow from going through the lungs. Tuberculosis is a bacterial infection in the lungs, long-time killer. That's actually treatable nowadays. Upper respiratory infection is a URI. That's you're talking about from here up. Sore throat, lose your voice, runny nose, sneezing. If it gets into a chest cough, that's lower respiratory. Emphysema and chronic bronchitis are components of what disease? COPD. Emphysema, the tissue melts away and you have big holes in there. Chronic bronchitis means it's constantly inflamed. It leaks a lot of goo in there and blocks the small airways with mucus plugs. And they usually go hand in hand. Very often, if you have one, you have both. What's called cor pulmonale? Right side heart failure caused by lung problems that don't let the heart to move the blood properly. Obstructive sleep apnea, when you stop breathing at night. How about some surgical terms? We can have a lot of otomies, making cuts into them, tomy, remember. We can have pexes, reaffixing stuff and back in place. We can have plasties, repair. Ectomies, take them out. Adenoidectomy, take out the adenoids. Adenotome, the instrument for cutting out the adenoids. Bronchoplasty, repair the bronchi. Laryngectomy, taking out the larynx, throat cancer. Laryngoplasty, repairing it if something goes wrong with it. Laryngostomy, making a new hole to the outside. Laryngotracheotomy, making a cut into the trachea and the larynx. Lobectomy, take out one of the lobes. Pleuropexy, repositioning and fixing the lung back where it's supposed to be if it collapses and falls out of place. Pneumonectomy, take a lung out because of lung cancer. Rhinoplasty, that's a nose job. Septoplasty, repairing the deviated septum. Septotomy, make a cut in it. Sinusotomy, make a cut in it. Make a hole in your sinus to drain out some stuff in there. Thoracocentesis. What's this? Amniocentesis? Taking out fluid. Thoracocentesis. What if you have a hydrothorax? What if you have fluid in there that needs to be taken out again? Thoracotomy, make a cut into it. Tomy. Tonsillectomy. Ectomy means to take it out, not just make a cut in it. Tracheoplasty, repair it. Tracheostomy, make a new hole, a new opening. Tracheotomy, make a cut in it. So we're putting a needle in here to draw out some fluid. That is thoracocentesis. Diagnostic terms. Radiography is using chest x-rays, basically. Nuclear medicine, you inject a radioactive isotope that glows under, some kind of imaging so that you can see where the air is going or see where the blood is going, depending on where you put this stuff. Ultrasound, remember that sono. Sono is the ultrasound, so you can do an ultrasound of your chest as well. Computed tomography, a CT scan. The computer is taking slices, so you're not using a knife, you're using the computer to make these slices so you can look at the different areas of the lung. Magnetic resonance imaging uses magnetism and its effect on the electrons and how they gyrate as they're knocked off their axis by the magnet to determine different types of tissue. It's the most accurate imaging system we have. And it has no x-rays. I mean, x-rays, a CT scan is like taking 50 x-rays. It's not great for you. Everybody can have a CT scan or two. My wife has had so many surgeries, she's probably had 12 of them. Be lucky if she doesn't grow a third eye. Magnetic resonance imaging, though, very clear. Magnetism doesn't seem to have any ill effects at all. Only problem is it's nearly $3,000 for the test. An endoscope, a scope is something you look through, so you put it inside and look in it. An endoscope generally goes down from the top, goes through the mouth or through the nose, and you can look in the stomach or you can look in the lungs. Laboratory tests that you can do, you can test the blood, you can test tissue samples, urine samples. With the lungs, you test sputum samples a lot. Sputum is the mucus that's produced in the lungs that comes out when you cough. It's not saliva. Saliva comes from the salivary glands in your mouth. This is the goo that comes out of your lungs. It's sputum, and you can test it to see what kind of bacteria is in there, and you can test it to see what kind of antibiotic kills those particular bacteria the best, so you can give the person the right treatment. Pulmonary function test, a PFT. That's where you use a spirometer. You blow into it, and you see how well you blow. You see how much air you blow. You see how fast it blows. And you can tell a lot about how well the lungs are functioning. A bronchoscope, look in the bronchi. Bronchoscopy is the field. A capnometer. Remember, capno is CO2. 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 Capnometer. Endoscope, looking down inside somebody. That's the scope. That's the machine. This is the referring to what you might get from the machine. This is the whole process or procedure field. Laryngoscope, same thing. An oximeter, you put on your fingertip and it tells you how oxygenated your hemoglobin is. Polysomnography is a sleep study. People with sleep apnea have to be tested to see if they really have sleep apnea and if it's actually disturbing their sleep. A radiograph takes x-rays. My horse's vet has a pet peeve. Everybody says, well, I'm going to look at an x-ray. No, you can't look at an x-ray. X-rays are invisible. But x-rays produce a radiograph. Remember, the graph is the piece of paper you get to look at. So the next time you're in there, I'd like to see my radiograph instead of seeing my x-ray. See if they give you a brownie point. Sonogram. This is the ultrasound machine. Sonography is the process of producing the graph that you can look at. Spirometer is the actual machine you blow into, and the field is spirometry. Thoracoscope, looking in the chest. Tomography, using the slice method to look at your internal body parts. Pulse oximetry. You can get these at Walgreens for $19.99 now, and they're actually pretty accurate. Gives you your pulse, and it gives you your oxygen saturation. Capnometer. See what your CO2 levels are. You have two problems. You might not get enough oxygen, or you also might build up too much carbon dioxide. Both things are not good. Here's the CO2. This is some kind of a spirometer, so she's doing a pulmonary function test. Chest CT scans are quite common. Just a chest x-ray is common. But a CT scan takes all those slices so you can see more of it. A radiograph, that's the x-ray. Ventilation perfusion scanning. You put an isotope in the air that you breathe in and look with the scanner to see where it goes. And then you put it in the blood and you see where it goes through the blood vessels, and you see if the blood is getting where the air is. Because ventilation and perfusion of blood should match up pretty well so you can actually exchange the gases. Acid bacilli smear to determine if bacteria are present. You can just take a sample and look at it. A sputum culture and sensitivity. This is the test I was talking about. If you can cough up a sample of goo and they can take it off and they check and see what's in it and what those bacteria are sensitive to, so you can give them the right antibiotic. Pulmonary function testing. You can do the PFT, blow in the tube and see how well the air moves. You can also, to arterial blood gases, you actually take a sample out of the radial artery. I've had one done. It hurts. Your arteries are a lot deeper than your veins. But they run it through a machine, and it tells you what your oxygen and CO2 levels are in your blood, your arterial blood. A peak flow meter, you blow as hard as you can, and it sees how quickly you can move air. And pulse oximetry is that finger thing. Gives you your pulse and your oxygen levels, oxygen saturation. The term auscultation is one you've got to know. It means determining by listening. And that's the way we take blood pressure. You put a stethoscope here and you pump the blood pressure up and you listen for the sounds. And you also auscultate for breath sounds. Your breath should sound nice and easy. It shouldn't wheeze and rattle and crackle and stuff. Auscultation. Percussion, you thump on the chest and see if it sounds hollow. If it sounds dull, it's probably filled with fluid. Somebody who's really good at percussing can tell a lot about what's going on inside. PPD skin test is for tuberculosis. If you're going into the nursing, the CNA program, you're required to get these. Just a word of caution, when you get them, make sure you get one on each arm. If you forget and they only do it on one arm, you're going to have to go back and get one on the other arm. Stethoscope is the thing you actually listen with when you auscultate. Which is a diagnostic imaging term. Pulse oximetry doesn't produce an image. Chest radiograph, diagnostic imaging. Yeah, that's an X-ray. If the X-rays produce the radiograph. This is a test for bacteria, and this is actually a test for a reaction to the tuberculosis test. What's capnia? CO2, CO2, capnia in the blood. Not enough or lack of CO2 in the blood. It's actually too low. Alveolar, talking about the alveoli. Anoxia, not enough oxygen in the blood. Aphonia, inability to speak. Apnea, can't breathe, stopped breathing, sleep apnea. Bronchoalveolar refers to bronchi and alveola. Bronchospasm, so you can't breathe. Diaphragmatic refers to the diaphragm. A diaphragmatic spasm could cause hiccups. Dysphonia, well, it's not that I can't speak at all, but I sound really funny this morning. Dyspnea, difficulty breathing. You have dyspnea if you have an asthma attack. Endotracheal, putting it down the trachea. Eupnea, it means you're breathing just fine, thank you very much. Hypercapnia, too much CO2 in the blood. Hyperpnea, breathing too fast or too much, excessive breathing. Hypocapnia, not enough CO2. Hypopnea, not enough breathing. Hypoxemia, not enough oxygen in the blood. Hypoxia really means there's not enough oxygen wherever you're talking about. Emia is definitely specific to blood. Hypoxia, it could be in the blood, but it could be in the tissue. might have a tissue that's not getting enough blood. So there's plenty of oxygen in the blood, but it's not getting to the tissue. So hypoxia means just not enough oxygen. Hypoxemia, specifically your arterial blood gases show your oxygen level in the blood is low. Intrapleural, within that pleural space between the lung and the chest wall. So you could have intrapleural effusion or intrapleural inflammation or something. Laryngeal, your larynx, voice box. Laryngospasm, if you breathe in something that is really an irritant, it can cause your voice to spasm up so you can't speak temporarily. Or even if you inhale a little bit of water. Have you ever tried talking right after that? Oid means it looks like a humanoid, looks like a human. Mucoid looks like mucus. Mucus is mucus. Nasopharyngeal, your nose and your throat. Orthopnea means you have positional breathing issues. You might have to sit up to breathe properly. Phrenologia. This is one of the few places where we use phreno instead of diaphragmato. Pain in the diaphragm, a stitch in your side. If you ever ran when you were a kid before you got any good at it and you got, a stitch in your side, phrenologia. Phrenospasm, hiccups. Pulmonary refers to the lungs. This is the doctor. This is the whole field. Radiologist is somebody who works with radiology, x-rays, CT scans and stuff. Rhinorrhea is just a runny nose. Remember what rhinorrhagia is? A bloody nose. And what's the other term for a bloody nose? Bonus points, epistaxis. Epistaxis. Tachypnea means breathing too fast. Remember, tachycardia is a fast heart rate. Tachypnea, breathing too fast. And thoracic refers to the thorax. Apnea means you're not breathing. Sleep apnea, you stop altogether. Dyspnea is difficulty breathing. Eupnea is good breathing. Hyper is too fast. Hypo is too slow. Ortho, when you have a positional issue, it might be hard to breathe sitting down but not sitting up. Tachypnea, breathing fast. Know what an airway is? Asphyxia is to suffocate. You can be asphyxiated by being choked to death, which is strangulation. But you can also be asphyxiated if you have a plastic bag over your head or if you lock yourself in a refrigerator and run out of air. To aspirate is to breathe something in. That's why if you're having surgery, they don't let you eat for 12 hours before or after midnight or something, because if you happen to vomit a little bit while you're lying on your back and they're working on you, you will aspirate vomitus. And with all the acids and stuff, it causes pneumonia very quickly, a lot of inflammation. A bronchoconstrictor will cause your bronchi to get smaller. A bronchodilator will cause them to get bigger. If you're having an asthma attack, you might breathe in a bronchodilator that will, like atropine or something, will cause your bronchi to relax and open up. Crackles and rails are the sounds that your chest makes if you have something going on in there. Instead of nice, easy air moving out, you hear crackles and squeaks and popping noises and stuff. Hyperventilation, breathing more than you need to at that moment. It'll probably might cause you to pass out. Hypoventilation, you're not breathing enough for your metabolism right now. Mucopurulent, mucus with pus in it. Mucus. A nebulizer is a machine that produces a constant flow of vapor that you can breathe in to help you breathe better. This is an interesting term. Nosocomial infections are hospital-acquired. Nosocomial, hospital-acquired. Iatrogenic are caused by a healthcare person or procedure. So an iatrogenic problem could be that they gave you the wrong medicine and as a result you got sick. But a nosocomial infection means that while you were in the hospital you caught pneumonia from somebody in the next room. A paroxysm is a sudden onset. Like if you breathe in something that's really like you're cooking hot peppers on the stove and you breathe it in and suddenly you go into this fit of coughing. That's a paroxysm. The term patent means that it's functional, working. So, for instance, if somebody's a IV drug user and they're trying to start an IV line at the hospital and they really have to look hard to find a patent blood vessel, one that's in good enough shape they can actually put the needle in it. Rhonchi are really deep rattles in the chest. Somebody with a bad smoker's cough has rhonchi. It sounds kind of like a snoring sound. Sputum is the goo that comes out of your lungs when you cough. Stridor is wheezing, really. Stridor is wheezing. And a ventilator is something that breathes for you or assists you in breathing. Acapnea, hypocapnia, hypercapnia, describing the amount of what? Carbon dioxide, carbon dioxide. Abbreviations, a million of them for respiratory stuff. Arterial blood gases. Acid-fast bacilli. These are the bacteria that are likely to be pneumonia causing. Adult respiratory distress syndrome. A couple of things can cause adults to go into a respiratory distress. It also can refer to acute respiratory distress syndrome. You have a infant respiratory distress syndrome that is usually due to premature babies that don't make enough surfactant, pulmonary surfactant in their lungs that allows them to inflate properly. So there's a childhood version. Adult versions are usually caused by breathing in something or maybe a deterioration of the lungs. If it's acute respiratory distress syndrome, and I should probably have that on here separately, acute respiratory distress syndrome is just anything that is keeping you from breathing right now. Culture and sensitivity test, testing for the bacteria and what they're sensitive to. Cystic fibrosis, carbon dioxide, COPD, chronic obstructive pulmonary disease. CPAP, continuous positive airway pressure. For somebody with emphysema, they have a hard time moving the air in and out of their lungs, and they put this thing in and it blows their lungs up so it opens the airways and allows the air to move easier. People will wear these at night too for sleep apnea, obstructive sleep apnea, because it kind of blows the airways open and doesn't let them collapse. Computed tomography, CT scan, chest x-ray, flu for influenza, idiopathic pulmonary fibrosis. fibrosis of the lung, so you can't inhale. Left lower lobe of the lung. Remember, left, you only have 2 over there. You got 3 on the right. Laryngotracheobronchitis, LTB. Got it everywhere. Oxygen. Obstructive sleep apnea. Pulmonary embolism. And a peak flow meter to see how fast you can blow air out. Pulmonary function test, spirometer. Polysomnography, looking at your sleeping patterns. Right lower lobe, right middle lobe, right upper lobe. You got 3 on the right side. Shortness of breath. Shortness of breath. Tuberculosis, upper respiratory infection. Ventilation perfusion scanning to see if the air and the blood are matching up in the lungs. Remember, continuous positive airway pressure to help keep your lungs open and your airways open. You can have 2 and 3 different levels. It used to be it just blew in. The only machine I ever had to demonstrate with was a single blow. And it was a little scary. It blew your lungs up a lot. But adjustable ones that can tell when you need it, are available, and ones that blow harder or softer when you need it more or less. Chest physical therapy. Dry powder inhaler. I sometimes get allergies, chamisa and other things here in New Mexico, and I've got a dry powder inhaler that you put a little thing in, it punctures it. When you suck it in, you actually suck in powder instead of a gas. Humidifier, meter dose inhaler, nocturnal nasal inhaler. You're probably not going to use these a whole lot unless you become a pulmonologist. Positive expiratory pressure, how hard you can blow out. Ventilator-associated pneumonia. People on ventilators a long time tend to get pneumonia from having the ventilator in. So they don't like to keep people on ventilators longer than they have to. Non-invasive ventilator called CPAP, abbreviated as CPAP. See what I say? The abbreviations are pretty easy generally to come up with. Okay, let's look at somebody who actually went to a pulmonologist. 24-year-old man visited emergency department because of dyspnea, difficulty breathing, hyperpnea, breathing too fast, paroxysms of cough, and the presence of thick, tenacious mucus, hard to get out of his lungs. Had a history of asthma since the age of 12. A chest radiograph, not an X-ray, but a chest radiograph was negative for pneumonia. Arterial blood gases showed hypoxemia, not enough oxygen in the blood, but no hypercapnia. His CO2 wasn't elevated. Pulmonary function test disclosed bronchoconstriction. So when he blew, it didn't come out very fast, and therefore they assumed that he has some constriction of the bronchi, corrected with a bronchodilator. A nebulizer was prescribed for treatment so he can go home and breathe it whenever he needs to. Asthma attack was probably precipitated by an episode of bronchitis, an infection, inflammation, chest cold that brought on an asthma attack. Normal chest X-ray. Here's the heart, but the rest of it should be mostly clear. This is what air looks like. blood and other things are white. So a chest x-ray, even though an x-ray mostly is good for looking at bone, it also shows fluid quite well. Atelectasis, lack of ability to inflate a part of the lung. Atel, not enough inflation. Atelectasis, that's over here. This one's open. This one isn't inflating. Bronchiectasis, a stretched out bronchi. You get that with emphysema and chronic bronchitis. The chronic inflammation causes deterioration of the walls. The inflammation is a process that it helps get rid of short-term problems, but over the long term can damage connective tissue and cause these bronchi to stretch out, and they also tend to start leaking mucus a lot. Bronchiogenic carcinoma, that would look like lung cancer. Bronchopneumonia, see all the white infiltrate. This is fluid in there. Hemothorax, this is blood up to here. Broke a blood vessel or something in here, or several of them, and it's allowed the lung to collapse and this to fill up with blood. Again, this is the heart. Streptococcal laryngitis, better known as a strep throat. Okay, these terms that we've seen before. What's a diaphragmatocele? Herniation of the diaphragm. Bronchiectasis, stretched out bronchi. Laryngotracheobronchitis, inflammation of everything. Rhinitis, inflammation of the nasal passages. Inflammation of the rhinoceros. I wouldn't like to face an inflamed rhinoceros. Rhinorrhea, also called epistaxis. Tonsillitis. Boy, mine looked even worse than that before I finally had mine out. The doctor tried antibiotics, but it kept coming back. But they had white pock marks all over them. It was pretty bad. Tracheostenosis, narrowing of the trachea. Here we have this pneumoconiosis, condition caused by dust in the lungs. Pyothorax, pus. Thoracalgia, pain. Rhinomycosis, fungus. Acute respiratory distress syndrome, caused by hantavirus. It killed a number of people out west. Comes from the poop of mice. And if you have horses or you're around barns that have a lot of mice and you breathe the dust in, you can get this hantavirus. I haven't heard much about it lately, but it was pretty lethal. People wouldn't know they had something really bad until they just couldn't breathe at all and would die of acute respiratory distress syndrome. Here's a good look at emphysema. Very little lung tissue in here. I mean, it's supposed to be clear, but it's not that clear. There's hardly any viable lung tissue. And because there's no recoil of that sponge, if you break the sponge apart, it allows to collapse. And look at the height. The lung is all the way, here's his shoulder. The lung is bulging up over here. And the diaphragm is collapsed all the way down to here. So somebody with emphysema tends to have really tall lungs. They're just not very functional. Deviated septum would need to receive a septoplasty, repair. Ideal CPAP, real CPAP. Pleural effusion. So you're leaking a lot of fluid. This isn't, you might wind up with a hydrothorax because the effusion is usually a clear liquid. Pulmonary edema. The lungs are simply filling up with water everywhere. Probably high pressure in the lungs, pushing water out of the capillaries. Tuberculosis. This is the tubercle. A tubercle is a hard fibrous ball that your body builds around the bacteria trying to defend against it. But it makes the lung so stiff that, that you can't breathe ultimately if you don't treat it. Adenoidectomy, taking out the adenoids. Tonsillectomy, taking out the tonsils. There's the tonsil coming out. Bronchoplasty, video-assisted thoracic surgery. So they're using a scope with a camera on it to repair damaged bronchi. Laryngectomy, taking out the larynx. Now look, here's the esophagus, but your lungs aren't even connected up here anymore. So you can't talk through here. You can never again will breathe through your nose or breathe through your mouth. The air has to come in through a stoma hole cut in the front of your neck. Lobectomy, taking out one lobe, right upper lobe in this case. Some more terms we've talked about. Otomy, make a cut into it. Ectomy, take it out. Plasty, repair it. Ostomy, make a new hole in it. Centesis, take fluid out. Rhinoplasty, got the bump on her nose removed. I love this. They put that little thing over her eye to make it so we can't tell who she is. Like if she was a friend of mine, I would never guess who she was, right? With that little thing over her eye. Alternative rhinoplasty. Pretty nice. You actually have your tear duct here is a tube that goes down into your nose. In most people, it's not that big. Septoplasty, repairing the deviated septum. Sinusotomy, making a cut into the sinus. If there's an infection in there and it's blocked it so that it can't get out, the pressure gets up so high it becomes excruciatingly painful, and they can open it up and remove whatever's inside. Thoracocentesis, pulling the fluid out. Reinflate the lung. Tracheostomy. So she can't breathe through her nose or mouth anymore. The trachea doesn't go up any farther than this. All it does is go from here straight down into the lungs. So she's breathing through this. Her only way of speech would be to hold one of those boxes over that when she exhales and make some kind of a sound come out. Transverse plane, cut Harry Carey style so you can look straight down from the top. The MRI image, additional clarity, for instance, of the spinal discs and so forth. Single photon emission computer tomography, SPECT it's called. And what you're doing here, and you have to be pretty good at reading these, better than I am to tell really what's going on, but you're putting, a radioactive dye in there, running it through the lungs to see where it goes, to see if air is going the right place, blood's going the right place. Bronchoscopy, using a bronchoscope to look in there. You might have to look in if somebody inhaled a walnut or something, so you can go in there and find it and pull it back out. Pulse oximetry. Just put it on. Saturation of the hemoglobin is 98%. That's really good. Heart rate's about 78. It's a little high, but heck, he's at a doctor's office. Laryngoscope. Look down and see the vocal cords. Laryngoscopy to intubate. They pull it back, they look down in there, and they make sure that they put the breathing tube in your lungs instead of down into your stomach. Remember, there's that where the epiglottis is, it's a pretty tight fit there. It could go this way and go into the esophagus and go that way and go into the trachea. Longest word in the world. I remember when this came out when I was a kid. Pneumono-ultramicroscopic silicovolcanoconiosis. And this was a scientist who coined this word just so he could create the longest word in the English language. It's a lung disease caused by dust from volcanoes, a silica dust from volcanoes, and it's kind of specific to volcanologists who spend their time breathing that stuff. But he had to make it as big a word as he could to make sure he got the longest one. At least he didn't name it Fred's coniosis, name it after himself. There's a nebulizer. It puts out a constant flow of vapor that you breathe to help you breathe better. Ventilator that actually blows up your lungs for you and relaxes and helps you breathe. Patient on a ventilator. And that's it for the respiratory system.